Hello guys, welcome back to my YouTube channel. So today I'll discuss a very important topic of endocrine system, that is diabetes mellitus. Whenever a person is having increased amount of blood glucose in their body, it can be either due to lack of insulin secretion, insulin action, or both. Today in this lecture we will be discussing about definition of diabetes mellitus, types, clinical manifestation, diagnosis, complications, and at last the management. So, diabetes, which we commonly call as blood sugar, too much sugar in our blood, it may cause serious complications and symptoms that we will be discussing today. Now I would like to discuss about etiology and causes. So, the causes are beta cell destruction, which may lead to insulin deficiency, immune mediated. Some are unknown causes. Thirdly, genetic factors. If a person is having any kind of disease in the pancreas like pancreatitis, pancreectomy, and cystic fibrosis diseases, then also a person may have diabetes mellitus disease. Other risk factors are obesity. Suppose a person is having overweight, he or she is having any kind of cardiovascular disease problems, then if a person is not doing any kind of physical activity or his or her lifestyle is sedentary, also if he or she is having high blood pressure, family history of diabetes mellitus, then also a person may have diabetes. Also, if a person is having polycystic ovarian syndrome and gestational diabetes, it may further lead to diabetes mellitus. Now, I would like to discuss about the different types of diabetes mellitus. Firstly, type 1 diabetes mellitus or insulin dependent diabetes mellitus. Second kind of diabetes mellitus is type 2 diabetes mellitus or non-insulin dependent diabetes mellitus. Thirdly is the gestational diabetes. So, before knowing the types of diabetes, let us know the role of pancreas in regulating insulin and glucagon. So, pancreas is a gland that secretes insulin and glucagon in response to glucose levels in the blood. Just after taking a meal, our digestion process starts and it breaks down carbohydrates into sugar molecules as well as proteins. These sugar molecules we know as glucose and proteins as amino acids. These glucose, sugars and proteins amino acids, it gets absorbed directly into bloodstream and glucose level gets increased. The insulin allows glucose to enter into cells in the body. Here insulin and other hormones direct whether glucose will be burned for energy or stored for future use in our body. When insulin levels are high, the liver stops producing glucose and stores it forms until the body is needed. Okay, so let's discuss about all the types one by one. So type 1 diabetes mellitus, which is also known as insulin dependent. It occurs mainly at age of less than 30 years. It can be either due to genetic causes, immunological causes or environmental factors. Then in here the most common complication is diabetic ketoacidosis, deficiency of insulin secretion, or sometimes maybe due to disease conditions like if a person is having disease in the pancreas, any kind of injury, pancreatitis, infection, inflammation also may lead to type 1 diabetes mellitus. Second type we will be discussing, that is type 2 diabetes mellitus or non-insulin dependent. In this condition, insulin production is there in our body, but the body receptors are unable to respond to that insulin. Generally, the older people, they used to get type 2 diabetes mellitus, and we can say that after 30 years a person may have type 2 diabetes mellitus. In this type of diabetes mellitus, there is decreased number of insulin receptors. Generally, the overweight patient or the obese patient may have type 2 diabetes mellitus because of the sedentary lifestyle or due to consumption of high fatty diet, which we'll be discussing later. The third type of diabetes mellitus is the gestational diabetes mellitus. It is generally seen in the pregnant lady, mainly in the second or third trimester. Here the placental hormone reduces the action of insulin, thus it results in the high glucose level in the blood. So it is mainly treated with diet, and if it is not resolved after following good diet also, a pregnant lady can take insulin therapy. And generally this gestational diabetes, it gets resolved after the delivery of the baby, but if it doesn't resolve, this gestational diabetes mellitus can further lead to type 2 diabetes mellitus in women. Now, I would like to discuss about clinical symptoms of diabetes mellitus. So, the classical signs are 3 P's. Polyuria, that is, a person will have excessive urination. Then polydipsia, a person with diabetes will have excessive thirst. He or she will feel thirsty. Then polyphagia, a person will eat excessively. Other common diabetes symptoms are tingling sensation in hands or feet, weight loss, a person will have blurry vision, he will feel weak, dizziness, frequently urination, headache, a person will feel hungry as well as thirsty. So all these are the clinical symptoms of diabetes mellitus people. Now I would like to explain about the diagnosis or investigative procedure. So first test is fasting blood sugar. Here the person to be tested should be on normal diet for at least 3 to 4 days prior to testing. Then the minimum duration should be 8 to 10 hours fasting. Then only we can take the patient sample of blood after the confirmation of fasting. Otherwise we can't do the fasting blood sugar test. So next test I would like to discuss about PPBS, that is the postprandial blood sugar test. It is the test which is exactly done 2 hours from the time of meal consumption. All the normal values as well as the abnormal values I will be discussing later in the next slide. Next test I would like to discuss is the HbA1c test, that is also known as glycosylated hemoglobin test, which helps to assess the blood sugar level in the last 3 months. Here it measures how much sugar a person got stuck in his or her red blood cells. Also, it is a test which shows how well your diabetes has been controlled in the last 2-3 months. For this test only they can change the medications if it is needed by the patient. Now coming for the criteria, how to diagnose diabetes condition as well as pre-diabetes condition. For the fasting blood glucose level, the normal range is less than 110 mg per dl, and for the postprandial blood glucose level, it should be less than 140 mg per dl. And for the random blood sugar, the person who is in diabetic condition, they are having greater than 200 mg per dl, as well as they will have the symptoms of diabetes. Then for HbA1c test or glycosylated hemoglobin test, a person will have normal value if it is less than 5.7%. Next, I would like to discuss about the complications of diabetic patients. A person will have eye disease, mainly retinopathy. A person will have cataract problems, glaucoma, renal failure. A person will have nephropathy. Then a person will have diabetic foot in the extremities. Then a person will have atherosclerosis, nerve diseases, heart damage, and brain stroke. Now the last part we will be discussing about the management for diabetic patients. Mainly for the diabetic patients, we will focus on the nutritional diet. So in the diet, we will see about the body mass index of our diabetic patients, about their activity level, how much physical activity they are doing, and depending upon their body mass index only, we will provide them diet. Generally for the diabetic patients, high fiber diet is good. Protein intake is also good, and a person should reduce their food that are rich in glucose and carbohydrates, especially high glycemic diet food. Also, the person should reduce the intake of fats, and so that cholesterol level will not increase, as well as the person will should limit the sodium intake in their diet. Person should also get advice regarding ensuring weight control, providing all the nutritional requirements that are needed for diabetes reduction. Then, focusing on the physical fitness, we should also ask them to do regular exercises. It will also help in reducing the sugar level, as well as carbohydrate metabolism will become faster. Then it reduces risks of heart diseases, as well as it maintains the blood pressure. Apart from that, we should advise the patient so that they will inspect their feet daily, because diabetic patients, they are prone to infections, and if a person is having any kind of cut or injury, it takes time to heal. Generally, the neuropathic disease, it affects the sensory motor and autonomic nervous system, which leads to impotence as well as foot ulcers. Other important measures for type 1 diabetes mellitus is insulin. Then for type 2 diabetes mellitus, already I have mentioned about the diet, about the weight reduction, about the exercise, and the changing of lifestyle. And for the medications, according to the glucose level that is found in a person's blood, physicians will give different kind of medications which will be helpful for the patient who is having high blood sugar level in his or her blood. Hope from this video you all got brief idea regarding diabetes mellitus, its types, various causes, clinical manifestation of diabetes, then about the diagnosis or investigative procedures, and at last we have discussed about the management. Mainly we have focused on nutritional diet as well as about the physical fitness. Hope this video will be helpful for you all guys. If you want any topics to discuss along with me, you can comment down in the comment section below. As well as if you have any doubts regarding this topic, you can comment down in the comment section below. So thank you. Till then, take care.